My project is about the role of social work at Rainbow Clinic and Columbus Free Clinic and how to improve providers' understanding about how to best use our services. My intervention aims to explore how to increase providers' knowledge about the role and scope of social work at Columbus Free Clinic and Rainbow Clinic. Columbus Free Clinic is a student-run organization which follows an integrated care model. The clinic is staffed by medical student volunteers, provider volunteers, and social work interns. It is home to specialty clinics, including Rainbow Clinic, Gyne Clinic, and Psychiatry Clinic. Rainbow Clinic is a specialty clinic that operates within Columbus Free Clinic. Its primary focus is on LGBTQIA+ affirming care. Rainbow Clinic provides primary care, gynecology services, urology services, PrEP referrals, gender affirming referrals, mental health evaluations, and STI testing. So the goal of my intervention is to increase providers' understanding of when it's appropriate to request a social work consult. Providers at Rainbow Clinic are often unaware of the role and scope of social work at CFC. And my question is, can a one-page newsletter shown to providers during a pre-clinic huddle adequately explain the key role of social work at Rainbow Clinic? I created a one-page newsletter that explains the scope of social work and outlines what we can and cannot do for a patient. The intervention had to be brief because the pre-clinic huddle is approximately 10 minutes long, and it's the only time to talk to providers and student volunteers at the same time. Also, the intervention has to be simple and able to be implemented on one clinic night because Rainbow Clinic operates every 2 months. My intervention is a program-level evaluation. The pre-test and post-test design allowed me to assess the immediate impact of the training. Internal validity could be impacted by testing effects, which is the idea that the pre-test itself can influence the participant's performance on the post-test. But in this case, the post-test was given immediately after the pre-test along with a flyer due to time constraints. So I would say that the flyer had the most impact on the post-test performance. My intervention is a program-level evaluation. The pre-test and post-test design allow me to assess the immediate impact of the training. Internal validity could be impacted by testing effects or the idea that the pre-test itself can influence the participant's performance on the post-test. However, with this intervention, I actually gave them the post-test right after they had the pre-test along with the newsletter that explained the scope of social work. Data was collected using a pre-test and post-test evaluation, and these were given to providers and med students during the pre-clinic huddle. Along with the post-test, providers received a one-page newsletter that explains the role of social work at Rainbow Clinic and Columbus Free Clinic. Providers and student volunteers' scores on the post-test were compared to the pre-test results. My goal was to measure whether post-test scores improved once providers were given a flyer explaining the role and scope of social work. One issue that I ran into is that a few of the post-tests were missing at the end of the night. So some people either didn't complete them or did not give them to me. I collected this data at Rainbow Clinic on February 8th of 2025. The plan was to measure whether post-test scores improve once providers were given a flyer explaining the role and scope of social work. One thing that did happen is that a few post-tests were missing at the end of the night, and I was not able to locate them, so I don't know if they got thrown away or what. It was only like 2. And I collected this data at Rainbow Clinic on February 8th of 2025. So question 1 asked, on a scale of 1 to 5, how well do you understand the role of social work in an integrated primary care team? And the pre-test median score was 3.5, and the post-test median score was 5 out of 5. The pre-test average was a little bit over 3.5, and the post-test average was about 4.5. Question 2 asks, which of the following does a social worker on an integrated care team help with? Circle all that apply. So there were 14 options, and the participants got 1 point for each one that they got right, whether it was circled or not circled. So the median score on the pretest was about 63% correct, whereas the post-test median score was about 96% correct. The pretest average score was about 57% correct, and the post-test average was at 88%. Here we can compare pre-test and post-test averages for questions 2, 3, 4, and 5. As you can see, the post-test averages show significant improvement. So these questions were, why is it important to consult social work before seeing patients flagged for mental health concerns? And the correct answer is to ensure holistic and integrated care. So that is question 3. For question 4, if a patient screens positive for a mental health concern, what is your next step? The answer is immediately consult the social work team for collaboration. And question 5, what is the primary goal of integrating social work into patient care at Rainbow Clinic? And the answer is to address behavioral health concerns as well as social determinants of health concerns. And the reason why we ask these questions is because we've been having an issue where we flag patients for a social work consult, but the providers don't notify us, and they end up coming to get us when the patient's, either leaving or going to get labs, and that's not really an appropriate time for a mental health intervention, so we miss a lot of encounters that way. So by giving a newsletter that explains why it's important that they come and get us right away, we're hoping that informs the providers and volunteers about how we like to do things at Rainbow Clinic. My conclusion is that a brief training can be a good way to train medical students and provider volunteers. It also could be helpful to laminate the newsletter and provide one for each pod during clinic nights so that they can refer to it if they have questions about what we're able to help with and what we're not able to help with. Because the other thing that, we've had issues with is a lot of times they ask us to do things that we, don't do, like determine whether someone has insurance coverage or, make medication recommendations or sign patients up for HCAP, get Medicaid for undocumented patients. Those are things that we cannot do. And so having all that on a flyer, just here's what we do, here's what we don't do, and having that available at the pods for a quick reference, I think could be super helpful in the future.